I know you're here to watch this pop, and believe me, it's going to be a good one. But first, I want to talk to you about your skin. When you're dealing with skin issues like acne, keratosis pilaris, dry skin, or dark spots, it can be really frustrating to know where to start. This is why I founded SLMD Skincare, to create effective products that really can treat the most common skin conditions that people experience. Sometimes you need to be treated and seen in the office by a board-certified dermatologist, like you're about to see, but sometimes you can really treat your conditions with products that are over-the-counter, like products that we have at slmdskincare.com. Use the code DPPYouTube to get 10% off your first order. That is a pretty big tense blister, tense versus flaccid. That is a way that we dermatologists differentiate these types of bulla, and it helps us to kind of narrow down the diagnosis. This kind of bulla, tense like this, is really pretty common, probably a burn or contact or something like that. Leave that skin overlying it. It helps to kind of keep and protect the wound, and it won't sting as much.
One more time. Do you see? Oh, that's a good one. Before it would just...
So this is actually accessory breast tissue, and you have a third nipple over that area. And that is not uncommon to have a nipple within this area along the milk duct line, we call it. Actually, as dermatologists, we often point out third nipples in people, and they had no idea that they have a third nipple, because not always are they associated with breast tissue as yours is. And that's why you produce milk when you're pregnant, and your breast is normally producing milk, but this is also producing as milk as well. And you have a nipple there, and that is why when you squeeze it, some milk is expressed there. My personal recommendation is, if you want that to go away, stop squeezing it, because the more you squeeze it, the more you express milk, the more it's going to produce milk, just like your breast when you're breastfeeding. There's something that's called the danger triangle, or the triangle of death on your face. When we are in medical school, we learn about this danger triangle. It is this triangle just like this. It goes from the corners of our mouth to between our eyebrows. This is where people say that if you have a zit in this area, be very careful because it could threaten your life. Kind of true, yes and no. There's an area behind this triangle called the cavernous sinus, and it's just right behind it. It's actually nestled right under our brain. So this sinus is a space that contains very important blood vessels that supply our brain, also very important nerves that supply our eyes. If you have an infection here, conceivably, if it were to spread, it has a higher likelihood of spreading to this sinus. If it causes infection in this area will swell and compress those nerves and compress those vessels. It can lead to blindness. It can lead to loss of your muscles around your eyes. It can lead to stroke. It could even lead to death. All those things being said, how often do you actually hear a report of somebody dying because they had a pimple on their nose? I don't think we really hear about that. And that is because in this day and age, with our excellent antibiotics that we have available to all of us, we really don't let it get that far that it can cause this sort of problem. In a nutshell, there is such a thing as a danger triangle. That is true. But for you to develop an infection in this area that threatens your life is extremely rare.
How are you supposed to know if it's a pimple or the herpes?
Herpes versus a regular pimple. How do you tell the difference? It is difficult, but there are a couple signs. You get a prodrome with herpes, meaning a few days beforehand, you kind of know something's going to happen. You have a weird pain sensation in that area before it breaks out. Also, this is a herpetiform distribution. This is herpes. You get this cluster or groups of blisters, vesicles, clear or with white fluid in them. This is not grouped in that same way. This is a group of pimples. I guess the most important thing to know is that herpes, there are some great treatments for them that can decrease the duration and the length and the severity of the breakout. So see your dermatologist for a prescription. Also remember that herpes is contagious when there's an active blister, so be careful around pregnant people and newborns. This is my patient, one of my lovely patients, who has a scrotal thumb. The feeling of this is really nice and kind of soft. And let me actually bring one of my girls in here. It's not uncommon to see genital tissue used as a graft to repair trauma that has occurred on the palmar surfaces of the hand. This tissue we know is more stretchy, more movable, and we need that in this very hypermobile area. This is often a staged procedure where your finger has to be sewn to the genital area for a few weeks so the graft can take. You may want to keep the hairs trimmed there or plucked. They are technically pubic hairs. And also in the cold, there's definite shrinkage. Okay, here we have a heel fissure. I think most of us have had something like this at some point in our life. I don't recommend that you pare these down like this. I don't think it's a great idea because, you know, we have some thickening there or some sort of callousing of our heels because we're walking around and we're moving around. It's thickened there to really kind of provide ourselves a natural cushion. If you do get fissures like this, paring this down is not going to make that better. You want to use super glue or something like that to kind of keep that sealed so that it will heal faster. Super glue or liquid bandage. But if you do have like thickening, like if you have medical conditions like palmar-plantar hyperkeratosis, which is like thickening of the palms and of the soles, or your elbows, or you're just trying to like make sure your heels look nicer, I would use a good glycolic acid. Let me comment a little bit more about this. It is pretty common for people to get fissures on their heels because that skin is really thickened and then it can crack. I recommend to my patients to use a liquid bandage or even a super glue kind of glue if you're not allergic to it. To seal those areas, because if you get into contact with like even acid or lemon or something like that, it's gonna burn, it's gonna be uncomfortable, and they bleed easily. It'll help them to seal and heal faster. To prevent them in the first place, use an acid like there are prescription levels for urea, there's glycolic acid, which is certainly available over the counter that can help to soften the skin in this area to help prevent these fissures in the first place. Have you heard a lot of dermatologists saying, don't use Neosporin? Well, this is why they say that. Neosporin is the brand name for a widely available antibiotic ointment that's really been around for years. And it contains 3 active ingredients, neomycin, bacitracin, and polymyxin B. It's most commonly used on scrapes and cuts, and a lot of people have it in their medicine cabinet. The idea is to use it on these cuts and wounds to prevent bacteria and infection. It is a very effective antibiotic, but there are a few reasons we tell our patients to be careful when using it. First off, neomycin is an ingredient that can cause allergic contact dermatitis in some people. This can cause redness, itching, and swelling, and this is when you get blisters and really itching areas in the skin. So sometimes it's better to err on the side of caution when thinking about how to treat your cuts and scrapes. And if you just have minor cuts and scrapes, just washing it with soap and water and maybe using petrolatum or Vaseline along with a bandage is more than enough to keep the wound moist and protected for safe healing. So in short, Neosporin and Polysporin are both effective antibiotic ointments, but make sure that you're using them in the right way, and certainly if you get an allergic reaction from them, stop using them right away.
So this is my unpopped burn blister of don't do that.
Burn blister.
Don't do that. Of about 6 days. I burned it last Sunday evening on stepping on a piece of coal. And it's very large and disgusting and very painful. Don't.
I would like to touch it.
Don't
please.
touch it.
May I touch your egg?
And at night, the pain is worse.
There are 2 main types of blisters or bullae. There are tense or flaccid blisters. And this is a tense one because it's deeper. It has damaged below the epidermis. And so that area over the skin is thicker. This is very difficult in the bottom of your foot because you can't function. You can't move around easily. And it is painful because of this tenseness or this swelling. It puts pressure on those sensory nerves. So it really hurts. My best advice to sort of alleviate this for you is to not take the roof off of that or the top off of this blister because the skin under there is raw. It has not healed. But make a little nick with a sterile needle, or have one of us dermatologists do it for you. Squeeze out a lot of that fluid. Keep that blister top on top there and let it heal that way. That will at least allow you to function too and be less uncomfortable.
Does anyone know why my legs do this when I'm in the sun? Like, look at it. It's like, what is that? Why are my legs doing that?
Yes, I know what this is, and I have it too. As you can see right here, see this little modeling pattern? It's usually red or blue, like netted kind of discoloration of your skin. This is vascular. This is normal too. It's a normal finding. It's called Livido reticularis or cutis marmorata. And it is completely benign, and it's just really the temperature change. Like you may be noticing when you go out in the sun initially and your skin is a little cooler than the environment. And when you're colder is actually when you notice it more. But I kind of have it all the time. And there's nothing you need to do to treat this. There's nothing you can do to treat this. But I try to disguise it a little bit. I try to put a little self-tanner on there, a little body makeup, especially if I'm doing the television show or I'm on air or something, or I'm making a TikTok. I'll try to like hide that a little bit. It's a normal thing though, and you're absolutely normal, nothing to worry about, nothing really to do to treat it. This guy is putting lemon juice in his hair. This is old school, man. This is before they really had proper bleaching ingredients that you can find in your local drugstore. It contains citric acid, which is a natural bleaching ingredient. Citric acid can be used in skincare to lighten brown spots. It's even used in laundry detergent to help whiten your clothes. My main concern with this is if you put this on your skin and you're out in the sun, especially like Lyme, for instance, it can cause a phytophotodermatitis, which is essentially a rash you're breaking out on your skin because that sunlight actually reacts with the acid in this product, and it can lighten your hair, but it can also damage your skin. It's like putting an acid on your skin and making it more potent with that sun exposure. That citric acid actually opens up your hair cuticle, and that sun will sort of strip away that first layer, and that is seen as lightening your hair color. It doesn't work as well in darker hair color. Sometimes it will make it more of an orange or brassy color. My best advice for you here is to have more control with this. Go to a drugstore and find an over-the-counter hair bleaching product, which is probably safer. Be careful putting it on your skin because I'm just really worried this dripping all over the face can cause a rash in some people, certainly. Okay, 3 days, 1 hour per day. That's pretty good, nice and conservative too. Before and after, he looks pretty good. I like that he doesn't have a skin reaction. Not done popping? Check out this next video or check out my all access membership page to watch more videos.